Good day everyone, I'm Biagasal I'm Del Mundo, and today I am discussing about the temporomandibular joint. The temporomandibular joint, the word joint is derived from the Latin verb ungere, which means to join, and articulation is derived from the Latin term articulare, which means to connect. We have different various terms of temporomandibular joint. We have temporomandibular articulation, mandibular joint, and craniomandibular articulation. The temporomandibular joint is described as the gynglimo-arthroidal joint. So the gynglemos, or hinge joint, is the manner of movement that takes place on one plate. Arthroidal joint is one in which the principal movement is of a gliding type. We have two movements, the gliding type and the hinge type. The gliding type, it occurs between the articular disc and articular surface of the temporal bone, and the hinge type naman is occurs between the interior surface of the articular disc and head of condyle.
Good day everyone, I am Tricia Rivera and I'm going to discuss some information about the temporomandibular joint. The temporomandibular joint is the articulation between the squamous part of the temporal bone and the head of the condyle of the mandibular bone. Anatomically, the temporal bone portion is divided into two parts, the posterior articular fossa or the mandibular fossa and the anterior articular tubercle. The bony components of the temporomandibular joint are the head of the condyle, the articular tubercle, and glenoid fossa wall. So this is the head of the condyle of the mandibular bone, the articular tubercle, and the glenoid fossa wall. And lastly, the fibrous components of the temporomandibular joint are the articular fibrocartilage, the articular disc, and the articular capsule. This is the articular disc and this is the capsule.
Hi everyone, I'm Adeline Panaligan and I'll be discussing the histology of the TMJ. So first is the condyle. The superior and anterior surfaces of the condyle are covered by hyaline cartilage. The surface is further covered by thick layer of dense fibrous tissue. The condyle is composed of typical cancellous bone covered by layer of compact bone. So here's the condyle. The trabeculae are grouped in such a way that they radiate from the neck of the condyle and reach the cortex at right angle, giving maximal strength to the condylar bone. So here's the trabeculae. In young individuals, the trabeculae is thin and with islands of hyaline cartilage. The spaces are large, containing myeloid or cellular type of marrow, while in old individuals, the cartilage resorb and are replaced by bone. And the spaces decrease in size and cellular marrow is replaced by fatty marrow. Next is the bone of glenoid fossa. The fossa is broader rather than deep, and the wall is made up of thin layer of compact bone in the center, suggesting that little stress is placed on this area. So here's the bone of the glenoid fossa. Next is the articular tubercle. The articular tubercle is the termination of the anterior root of the zygomatic process and contributes to the formation of process of temporal bone. The lateral aspect of the tubercle is convex with a height of about 5 to 15 mm. So here's the articular tubercle. Next is the articular fibrocartilage. This fibrous component is made up of thick layer of fibrous tissue with variable numbers of cartilage cells covering the condyle, fossa, and tubercle. It is fairly even in distribution along the condyle, thin in fossa, and thick along the articular tubercle.
Good morning, my name is Isabel Garcia and I'll be discussing about articular disc. Articular disc is also called meniscus. In young individuals, the articular disc is composed of dense fibrous tissue. The interlacing fibers are straight and tightly packed. This is an oval fibrous plate found in between the condyle head and the mandibular fossa. It is a vascular, semi-rigid, biconcave disc which serves to adapt the body surface to the joint during functional activity. The articular disc divides the joint into two anatomically and functionally separate compartments, the superior compartment and the inferior compartment. Each compartment is lined by its own corresponding synovial membrane. First is the inferior synovial cavity. It is the lower cavity between the condylar head and the disc. Then the superior synovial cavity. It is in the upper cavity between the temporal bone and the disc. The meniscus has three parts. First is the anterior band. It is the thinner anterior segment which is continuous with the ligament fibers of the lateral pterygoid. Second is the intermediate band. It is the connecting part of anterior and posterior bands. Then third is the posterior bands. It is the thickened posterior consisting of upper stratum which is attached to the condyle on its medial and lateral border. The posterior segment of the biconcave disc is thicker and is connected to the auricular capsule by vascular connective tissue known as the bilaminar area.
I'm Ana Castillo and I will discuss the articular capsule. So the articular capsule, it consists of a vascular fibrous connective tissue and it has two portions which are the outer fibrous layer and the inner or synovial layer. So this is the outer fibrous layer and this is the inner fibrous layer. So as you can see here, the outer fibrous layer is taken on its lateral border to form the temporomandibular ligament. It is attached to the lateral border of the articular border and it is inserted to the posterior border of the neck of the condyle. Posteriorly, the capsule envelopes the posterior glenoid process. The next portion is the inner fibrous layer. So this is the inner fibrous layer and as you can see, it is a thin layer. It is a thin layer of loose connective tissue containing a network of capillaries. This connective tissue may reflex into the center as villi or folds. The synovial fluid is a dialysate of blood plasma containing globulin, and mucin is clear, yellowish, and viscous fluid. So we have now the blood vessels and nerves. So the blood vessels of the vascular part of the temporomandibular joint is supplied by the superficial temporal branch of the external carotid artery. Next, for the nerves, you have three. The first one is the branches of the auriculotemporal nerve. Next is the mandibular divisions of the trigeminal nerve. And the last one is the sensory branch of the facial nerve